as I'm sure everybody is aware, in the last few days there have been many questions about the most recent variant of concern, the Omicron variant that was detected first in South Africa and has now been detected in many countries around the world. And as you know, we have been looking here in BC as well. And today we have identified our first case in BC in a person in the Fraser Health Authority who recently traveled and returned from Nigeria. They are isolating, and public health is, as we do with every case, following up with them and their contacts at this time. To date, the Public Health Agency of Canada, who we've been working closely with since late last week when this was first identified, has identified 204 people in BC who were recently in affected areas. And the quarantine service, working with our teams, have connected with all of these individuals over the past few days, and they have been sent for PCR testing and are in isolation. We have a robust program here in BC and have had from the very beginning, using whole genome sequencing to help us understand what strains are transmitting to whom. We've been using them for helping us identify transmission in outbreaks. And as you know, over the last number of months, we've done a very comprehensive program. We did 100% of all of our cases for a period of time. And as those cases increased, we targeted our program to make sure that we did whole genome sequencing on 100% of cases for 1 week a month, and then a proportion for every other week. Plus, from the beginning, we have been doing a whole genome sequencing on any positive COVID test from anybody who's traveled internationally, and that is how we detected our first case today. We are going to be continuing doing whole genome sequencing on 100% of our clinical samples, as we have been doing. And I will say as well that we did, especially when this new variant became known, we did look back at all of the whole genome sequences that we have. And this process helps us understand how the virus has evolved. And we can be confident that we're not seeing widespread transmission of this variant in BC yet. We know that that these concerning mutations can arise, and where vaccination is low in parts of the world, they can spread rapidly. It reminds us as well that this new variant of concern reminds us that we are in a global storm and that it is not equal everywhere around the world. And equal access to vaccination is something that's going to be important for us to get through this. So there is still a lot we do not yet know about the Omicron variant, and it will take some weeks for us to get sufficient data to understand. And this will entail careful surveillance, which is one of the things that we're doing in Canada and here in BC, and enhanced whole genome sequencing, as I've mentioned, and epidemiologic studies to help us understand who is being infected, whether it's causing more severe disease. These are the things, the data that we need to understand if this virus is going to be, this strain of the virus is going to be more transmittable than the ones that we've seen so far. There are some suggestions that it might be, but whether it will outcompete the Delta variants that we've seen so far here in BC is yet to be known. So that's, of course, the AY25, 27, and a smattering of the 4.2. Whether it causes more severe illness is something that is also still unknown. And whether vaccines are less effective or people are more likely to be reinfected after being infected with a Delta strain, for example. These are the questions that we will be working with colleagues across the country and around the world to help answer for everyone. In the meantime, the Government of Canada acted quickly to put in restrictions on travel to try and slow down the introduction. As we have seen with every single variant that has arisen, we cannot stop this virus from transmitting, but what we can try and do is slow it down to help us understand exactly where the virus is now, where this variant of concern is, and that's one of the things we've been doing. I call it case finding right now, to have an understanding of where it is. But it also means that we need to take cautious and prudent action as we go through this next few weeks. Here in BC, we are fortunate that we already have many protective measures in place, but we must anticipate and plan for the worst, even as we hope that this strain will not cause the havoc that we've seen with some others. Tried and true public health measures work. We have seen this repeatedly over the last 2 years. We know that, and we know that they work against all the variants. First and foremost is vaccination. And yes, while vaccination doesn't prevent 100% of infections, we have seen how important it is at protecting people from more severe illness, particularly with the Delta variant. We've seen the strain on our healthcare system when we've had even small outbreaks in groups of people who don't have that protection from vaccination. And we are thankful that we have vaccination to help us weather the strain from the Delta. But we also know that masking, especially when we're in indoor crowded spaces, physical distancing, limiting our gathering sizes, especially when they're indoors, and good ventilation are things that make a difference in helping prevent the spread of this virus. Those things are the same. And in the excitement of the holiday season that's coming up, and with our ability to enjoy so many activities that we have here in BC that had been restricted for many months, let's not forget that we are not yet over this pandemic. We live in a global community, and we are all affected by what happens elsewhere, just as others are affected by what happens here. So these border restrictions that we have in place, and I know there's some new measures being announced today, but until everybody in the global community has the ability to be vaccinated and has the same protections we do, we are all still at risk. As I said, the best thing we can do is to protect ourselves and our loved ones and our communities by getting the protection that vaccines offer. And we now have that added protection that, as of yesterday here in BC, children 5 to 11 years of age are also able to be protected with the pediatric vaccines. We wanted to ensure that every parent had access, and as you can imagine, here in BC in particular, it takes some days for the shipments to come from Ontario to us, and then for us to be able to distribute them. And I just want to give thanks and kudos to our teams across the province. There have been extreme measures to try and overcome some of the geographic barriers that we have had because of floods, because of roads being disrupted, because of supply chains being disrupted. And it has been a Herculean effort, literally, when that some of our vaccines were actually flown by Hercules, and thanks to our partners to help us get those to places across the province. I had the wonderful opportunity to be at an immunization clinic yesterday in Victoria, and there was excitement in the room and relief. Relief on the faces of parents and a little bit of anxiety and relief on the faces of children once their vaccines were got. And to all of those children who got their vaccines yesterday and today and will be getting them in the weeks ahead, I just want to say you are all brave and vaccine heroes. And parents, now's the time to learn more about the pediatric vaccines and to get your children registered. And yes, you will get an invite, and they will be eligible in the next little while. I do want to remind parents and everybody that pharmacies are coming online to help particularly with the booster doses. And right now, they only have the vaccines that are for children 12 and older. So you cannot get the pediatric vaccines out at the pharmacies at this point. And soon, though, we will have more pharmacies online across the province to support our booster campaign. I also want to put a call out to the many recently retired doctors and nurses and other healthcare providers and other immunizers who stepped up when this vaccination campaign started about a year ago. We need you back now. We can use you in our clinics across the province. We've been stretched, as you know, in our healthcare system, and we could really use the support of immunizers. So I encourage you, if you have some time, to connect again with the health authorities and to come back and be part of our wonderful vaccine program again. Given the heightened concern with this Omicron variant of concern, I would like to remind everyone about the importance of using all of our layers of protection as we head into winter and into the high days and holidays ahead. This includes washing your hands regularly, keeping our groups small, choosing outside instead of inside, and staying home and away from others if you're sick. Having vaccinated people only, particularly if it's an inside gathering, or if you have elders or seniors or people whose immune systems are compromised. We need to protect them through this highest risk transmission season. I also want to clarify the Provincial Health Order on masks. It requires everyone 5 years of age and older to wear a mask in all indoor public spaces. This will become more and more important, and we've seen that around the world as people are dealing with this new potentially increased transmissible variant. It's an important measure that we all need to adhere to here in BC. And as we enter this holiday and winter season, I am amending the mask order to include a requirement that participants attending worship services, including choirs, must wear a face covering, a mask, during services. These masks can be removed for eating or drinking to allow for ceremony activities, and readers and celebrants can remove them if distancing is in place during the celebration of the ceremony. As well, I am adding to our events and gathering orders a requirement that worship services must be limited to 50% of seated capacity unless all of the participants are vaccinated, in which case full capacity or 100% can be used. The province, as you know, has a proof of vaccine card available for faith services to use, but will allow flexibility for you and your congregations to work with congregants to provide proof of vaccination by other means. And I know that many faith services have done this already, and many faith leaders are working with their own communities to make sure that we have these measures in place to protect people over this period of time. As well, I want to update people on the additional restrictions that have been in place in interior health. And with the decrease in transmission and the leveling off of our hospitalizations and the strains in communities, the additional measures in place in interior health will be repealed as of tonight. And the current restrictions that are in place, both the mask mandates and the gathering and events orders that are in the rest of the province, will apply to all of interior health. So that means that you can have 100% capacity when the vaccine card is being used, for example. In addition, the Northern Health restrictions, the Chief Medical Health Officer in the North has reviewed the restrictions that are in place there, and we've been in a transition period, as I've mentioned over the last week and a bit, to try and ensure that we are having restrictions that are commensurate with the risk in those areas, as well as the strain on the healthcare system. And so Northern Health will be revising their orders, one to have an expiry date of January 31st of 2022. The order will cover all of Northern Health Authority. It will include that bars and nightclubs remain closed. Restaurants must continue to end their liquor service at 10 p.m. Given the situation in the North, there is still no in-person worship services being allowed at this time, although drive-in services will be permitted. Social gatherings at private residences will be for up to 10 people inside or 25 people outside if people are fully vaccinated. Outdoor events with more than 25 people will have a 50% capacity with use of the BC vaccine card. And indoor seated events with greater than 10 people will have a 50% capacity limit, and that includes funerals, weddings, sporting events, theatre, arts and performance events. And I know some of these were restricted to a much lower number in the past, so these changes will come into effect starting tomorrow as well, with the use of the BC vaccine card. In addition, the restrictions that are in place in the Fraser East region will remain the same. We know there are many things that people are dealing with in Fraser East right now. So this is a lot for us to think about today. I think we are reminded that we're not out of the woods yet with this pandemic, and we are in a most difficult and challenging time. And people in British Columbia, across our province, have been tested repeatedly, not only by the pandemic, but also by nature, as we continue to see today with the ongoing rain and flooding risks. The days are darker and colder and shorter, and we're spending more time indoors, where this virus continues to spread more easily. At the same time, our risks remain high globally as we see transmission in countries that don't have access to vaccination, where variants of concern like Delta and now Omicron emerge. Despite this, we see every day the strength and resiliency of our communities across BC, and we persevere. And there are rays of hope. We know now that being able to protect our younger children is a really positive thing for families across the province. And we've seen the support and heroism from our neighbours, from our first responders, and from our healthcare workers. And you have my gratitude. We also know the more people who are immunized, no matter what age, the safer we all are. And it's one less thing for us to worry about as we get through this challenging time together. We will get through this storm, this many storms together. And we need to do that by continuing to have that compassion and kindness for each other and doing all of the things that we know will keep us safe. Thank you.
Thank you very much, Dr. Henry, and I wanted to start by saying that I'll be providing a number of updates, some of them shorter than usual today, because there is, of course, a significant number of questions that may come from what I'm saying, what Dr. Henry's saying, so I want to give you some time for that. I do want to say that a year ago, the independent review of BC Healthcare, led by Dr. Mary Ellen Turpel-Lafont, was released. In plain sight, addressing Indigenous-specific racism in BC, BC Healthcare confirmed widespread Indigenous-specific racism, stereotyping, and discrimination within the healthcare system in BC. We will be responding to this in more detail later today, including efforts to address the recommendations in her report and to create a culturally safe healthcare system for all, including where we're making progress and where there's more work to do. I understand Mary Ellen Turpel-Lafont will be releasing her own response as well, and that should come at approximately 3 o'clock. I can also report to you today on the vaccination rates within the BC Public Service. As you know, vaccination is a term of employment within the public service at this time, adding another layer of protection for government workers and the people they serve. The vast majority of public servants, like the vast majority of British Columbians, are fully vaccinated. As of today, more than 98% of BC's public service employees are partially or fully vaccinated, and 97% are fully vaccinated. A small number of people will have legitimate reasons why they do not get vaccinated based on a medical or other condition. And we have received a small number of accommodation requests. It's 0.72% of the workforce. Those are being reviewed on a case-by-case basis. I want to thank the members of the public service who have been vaccinated in such massive numbers for all they're doing to protect themselves, their coworkers, and the people around them from COVID-19. I also want to note with respect to vaccination that we're at 4,212,517 first doses, 4,056,228 second doses, 419,163 third or booster doses. I just want to put that in context because people will often think back 6 months ago or think back to when they got their first dose. But about 6 months ago, about at the end of May, we saw approximately 200,000 second doses. So the work on third and booster doses is significant and positive. Further, I know that there's interest in registrations and booking of children 5 to 11. 114,106 children 5 to 11 have been registered in BC for their vaccination. And as of 11 o'clock today, 41,697 have booked their appointments. So I appreciate the progress that's been made and certainly ready to answer questions on that subject. Next, I just want to note that the federal government made an announcement at 1 o'clock, which all of you will, I think, be interested in. They announced they're adding Nigeria, Egypt, and Malawi to the list of countries involved in the temporary travel ban to the list that was announced last Friday. And also, the federal government announced that they'll be requiring all air arrivals except from the United States to have arrival tests and self-isolate while waiting for results. We understand the federal government will be providing kits to individual travelers on arrival and have or are contracting with a number of providers to provide the tests and deliver the results to individuals. And obviously, we're assuming that the protocols will be in place, and I expect they will, to keep provincial public health informed of any positive results. We'll be meeting with the federal government. Indeed, there's a meeting at 2:30 at the end of this press conference to discuss the details and the challenges of implementing this measure. But I want to say this. We're supportive of the federal government taking precautionary steps until we better understand the potential risks of the variant, as Dr. Henry has said, in the coming weeks, and we'll work with them diligently as we have from the beginning of the pandemic as they roll out these new measures. I want to note one of the key elements of what BC has done that is, I think, distinctive and important is the investment that we've made in contact tracing. I want to note that there are a total of 1,661 contact tracers in BC. We were working on contact tracing as of November 26, 2021. Also a very challenging time for our healthcare system. I just want to note we be up to date on capacity and the number of people using our healthcare system. Just to say that we have, as you know, 9,229 base beds in BC. We have 2,353 surge beds in our province. And as of today, we have just over, I think it's 9,302 people who are inpatients in BC hospitals. In critical care, we have 510 base critical care beds, 218 surge critical care beds, and the number of those in critical care in total is 489. And as noted, and for people in the north, this will continue to be of interest. 144 critical care patients have been air transferred out of Northern Health. 113 of those have confirmed to have COVID-19. And finally, with respect to surgeries, you'll note that from November 21st to November 27th, health authorities postponed 230 non-urgent scheduled surgeries. That's 16 in Fraser Health, 17 in Northern Health, 4 in Vancouver Coastal Health, 25 in Vancouver Island Health, and 168 in Interior Health. No surgeries were postponed in the Provincial Health Services Authority. Cumulatively, from September 5th to November 27th, there have been 3,451 surgical postponements. But I want to say an enormous amount of surgery is also taking place in the province, certainly in parallel to what's happened in previous years and pre-pandemic times. In the most recent week for which we have statistics, October 31st to November 6th, 6,918 surgeries were completed in BC. And obviously, all of this brings great relief to those needing surgery and to their families and reflects the extraordinary work that it continues to take place across our system. I think surgical renewal obviously means the most to those in need of surgeries and to the family and friends and families who love and support them. But I believe it's also a statement of resilience by our extraordinary healthcare teams around the province, by communities, what we need to continue to do in our healthcare system while dealing with the challenges of 2 public health emergencies and other extraordinary challenges that we're dealing with, such as the implementation of the In Plain Sight report. No matter the moment being faced in our BC pandemic, those who deliver surgeries to those who need them show us achievement that adds to our appreciation of welcome moments and lessens the weight of those that challenge us. It simply does. It is, I think, an example in which we can all find strength in our own resilience, no matter what moments we're facing in our BC pandemic. With that, thank you very much, and we're happy to take your questions.